of patient education, and sort of getting people more used to using Econsult, and also just getting your feedback. This is actually a key part of all of you being on here, is listening to what works, what doesn't work, and kind of just any extra comments. I know there have been some questions sent through already, so I'll go through as many of those as I can at the end. But Econsult is always looking to improve it, so your feedback is really useful in doing this. On the call, I have with me Mark, Nikki, and Newman. They work a lot more with the actual practices themselves and the CCGs, so they kind of hear things from the other side of, I guess, the coin to you guys being as the patients. So any questions you do have at the end, sort of, we've got a good range of people on the call here, so hopefully we'll be able to answer everything on the call. If not, please either let us know and we can ask another member of our team, or we'll sort of make our emails available, and feel free to ask on there, because I realise that some questions you might not want to ask on something like a webinar. Having said all of that, what I'll do is, if I can, I'll just share my screen, and I've got a quick presentation to go through. So hopefully, has that come up for everyone? Okay, perfect. So as Dorset's been using Econsult for a while, what I'll do is, there are a couple of slides which I'll go through a bit quicker, just because I'm aware that some of you have probably heard of Econsult and hopefully used Econsult before. So I do want to save as much time as possible for questions and feedback at the end. But I'll make all of these slides available. There's a couple of links in there as well, so feel free. The other thing I was going to say is, if you see me moving around a bit weirdly, it's not because of the call. I broke my ankle last week, so I'm still slightly getting used to the cast. So yeah, just as a pre-warning if I do look a bit weird moving around. So first of all, I think obviously this is obvious for everyone, but 2020 was not a normal year. Online consultations are becoming part of this new normal in terms of accessing healthcare. From speaking to both patients and practices, I think this is obviously going to become part of the new normal. Just like telephone was a very normal way of contacting your GP before, online is being added to that normal way of contacting your GP. So as with GP practices, we've also had to adapt and change because of the pandemic, and we're putting in new features to help patients and practices that are coming out, having come out of the pandemic, that will be useful. And the final thing is, and I'll make this clear kind of a couple of times throughout, but online consultations are not for everyone. They're never meant to be, and we never want a practice to be enforcing them as the only way to contact the practice. They are very useful for certain people, and for some people they're just completely useless, and that's fine, because the other forms of contacting the practice are still available. However, we're finding more and more patients are finding online access more useful. So I'll just go through a bit of that in detail. So before I start, I just want to make clear, so Econsult was started by a group of NHS GPs. They are still practicing today, but they created it for a reason. And sort of that reason was to help make their practice more efficient and be able to look after all of their patients in a much more effective way. So at the heart of everything that we do is patient safety, and it's really key for us. And I'll go through that in a bit, but there are some things that when you first use Econsult might not sort of, you might question it, but there are a reason why everything has been built in, and for most of those things it is all patient safety. So first of all, and this might sound very obvious, but what is Econsult? It is a history taker, so it's a way of inputting your symptoms or requests to the GP practice. It is not an appointment booking tool. So the difference there is that with Econsult, you'd go online and you'd submit your request or symptoms, and then the GP practice themselves would be the one to make the decision on the most appropriate care for you. If it is an appointment, then one will get booked in. But there's quite a lot of things that can be dealt with either just over the phone, or just with for example, if you've asked a question about your prescription, that doesn't require an appointment with a GP in person. So you could make that question online and you'd actually get a response much quicker, whether that's via an email back, a text, or a phone call. So Econsult allows patients to access their health, access and request healthcare from their own practice online. Submitting online means no phone queues. So for people who can't use online, the phone queues the phone line is still there. But going online, because of the way that online things work, you can submit it and there's no queue. So for some people who can use it, it can be a much quicker way to make that initial submission. at the end of all of it, all requests to the GP practice are triaged in exactly the same way. So if you came in and you walked in, or you phoned in, or you did an e-consult, the practice is still going to look at it in the same way. None of them are a queue jump to get an appointment. They're all kind of triaged at the end in the same way. So I just wanted to bring this image up very quickly. So this was actually sent through from one of our colleagues earlier. So their sister had said she had forgotten her password to one of the online services at her GP practice, and asked the GP practice for help in trying to recover that password. The practice came back and said, which one of these online services is it? So this is for one single GP practice, and it's probably quite similar across lots of GP practices. There are lots of online platforms available for patients to use, and one single practice might have 20 different online services. So we do understand why there can be confusion in what eConsult's for, and just sort of want to make that clear that there are specific benefits of using eConsult. What we have actually found when we had a little look through these is quite a lot of these actually do quite a similar thing. So we do want to highlight what eConsult is for. And obviously this is not the same for all practices. This is one particular practice, but it is kind of make it clear that especially since the pandemic, GP practices have looked to use more and more online tools. So it can be confusing to make sure you kind of understand, and also helping other people understand what all the online platforms are for. So I'll go through this quickly because I feel that probably a lot of this audience do know what eConsult does and what it's for, but essentially patients go online either to their practice website or via the NHS app, and they can submit their symptoms or requests online. So eConsult, as an online consultation platform, is a mixture of structured and free text questions. So what I mean by structured is you're asked a question and then you have a multiple choice afterwards. Whereas free text is you're asked a question and you put the answer in your own way. There's a big difference between that, and there's a reason why we use both of them, which I'll highlight in a second. So after that, the practice receives the eConsult and then triages it. So the GP practice reviews each eConsult and triages it based on clinical urgency. In some practices, the admin and clinical eConsults are split out immediately when they come in. So the admin team will just look at the administrative ones, and that means that the GPs can be sort of reserved. The GPs and nurses can be reserved for the more clinical ones, so that you're sort of getting routed immediately to the most appropriate person for your need. So this is a graphic version of how it comes through to the practice. I haven't put a real one up here just because obviously that would be sharing patient information, but this is kind of roughly what they look like. And there are little dots on here. These indicate red flags. So our system and the algorithms that are used automatically help highlight things that we think are of clinical importance or more clinical importance than other things for the GP to look at. So they can scan through and say, right, this person's got 3 red flags on here. I'm going to read those things first, and then I can look at the rest of the detail, so that they can start looking at who needs to be seen, who needs an appointment straight away, so that if you do need an appointment, you can get one much quicker. And especially during COVID, what we've found is around 70 to 90% of all requests to the practice can actually be closed remotely. So this means without a face-to-face appointment being needed. So if you think of everyone in the past might have said they need an appointment, now it's that sort of 30% can get an appointment much quicker because the GPs are able to triage the others and deal with them in a more remote manner. And obviously, given the current circumstance, especially with social distancing, etc., a lot of people do actually want to try and avoid coming into the practice if they can. So this again can help with that, and sort of there are lots of channels to help deal with the patient remotely afterwards. So I just wanted to highlight why having structured and free text boxes is important. And this is one example that got sent through to us on Facebook a few weeks ago, actually. And the patient's given permission to share this. So I won't go through the whole story completely, but essentially a patient had been back and forth their GP practice spotting for a number of weeks, I think, or a number of years actually. And the GP practice had originally just prescribed medication for this. However, the patient, considering her age and that she was well past menopause, thought that she needed an examination. However, because of the way that the practice had originally been speaking to her over the phone, some of these really critical questions had just been missed, and of no fault of anyone. That's how the process had been, and it had seemed like just medication would have been good. But she submitted an e-consult, and because those extra questions, the structured ones, were included, which give you sort of free the multiple choice questions, those additional bits of information were picked up. and she was given an examination and she was diagnosed with cancer. So she was picked up quite quickly because of this e-consult, because of those red flags highlighted to the GP that actually maybe an examination would have been good. There are other instances with this, but there's a big difference between allowing a patient to just input what they think is important and having that plus some extra questions, because occasionally there's an extra question which as a patient you might not think is very relevant at all, but actually at the end of it, when it's combined with your free text information, can make a real big difference in terms of the outcome of that. And again, as with all of these, it is just making sure the right patient gets to the right care quickly. So someone who put in something very extreme in their free text box might have just be seen quicker by the GP, because that's the same kind of information the receptionist would get. So that's why we have a mix of the two, is just to try and make sure we get the right patient to the right care quickly. So Econsult has been going for about 6 years now. We're now live in over 3,000 GP practices across the UK, and that's over 29 million patients have got access to Econsult. So we're now receiving, or helping practices to receive anyway, around 1 million e-consults every month. So we have been through the pain points of knowing, like making mistakes in the past, but we're now at a stage where this is happening very smoothly and more people are going online to complete e-consults. And we know that more and more demographics are being able to use it. So I will go through these quite quickly, but I just highlighted a couple of different areas which we know have found big benefits from eConsult in the past. And this isn't to say that it's the same in every single practice or this is an exhaustive list, but these are just a few. So there's young parents. From us, what we've heard from patient feedback is that especially parents of very young children, quite often they're quite looking just for reassurance of some of the new healthcare issues which they've never had to deal with before. So, for example, if they'd woken up and their child had a rash, the child might not have any other symptoms, but they do want to get that checked out with the GP. And if they're also having to work from home and homeschool at the moment, it can be quite hard to find the time to spend an hour on the phone to get through to the practice. With eConsult, they could go online first thing in the morning. They could submit a photo of the rash as well and all the extra information. And the GP could look at it when they can, and then get back to the person if it needed to be sort of seen to. So that can be like one instance of use. But again, students, and obviously less students are actually in halls at the moment, but we have also heard, and especially students very used to using online platforms with banking, shopping, etc. They instinctively go online, and for example, they're quite often using the NHS app. So we've found a lot more students using the NHS app than other demographics. But again, this might be the first time they're looking after their own healthcare. So again, they do want that extra bit of reassurance, which you can do with eConsult, because you can just go online, submit your needs when you have them, and the GP practice will get back in touch with the most appropriate care. So this next demographic, this is quite contentious to put up really is here, but elderly who have access to technology. I only put this up here because we really often hear from patients and practices saying anyone over the age of 60 can't go online because they don't know how to use it, which is completely untrue. There are people who haven't used technology before, but that doesn't mean to say it's a blanket thing. And we do quite often hear stats, which I'm very sure are made up, of how many patients over a certain age have the internet and things like that, because what we're finding is more and more people over a certain age are going online, and especially during the pandemic, more people who might not have used technology for certain things in the past have started going online for certain things. So for example, their banking, their shopping, and now their healthcare is available for them. One thing that we have put in, and this isn't just for elderly people, of course, but we have got clinical review templates, and these are especially useful for people with long-term conditions. So for example, if you have hypertension, diabetes, asthma, and you do need to submit regular readings to your GP, there are special e-consults available there for you to submit them, which can be really time saving, because in the past you might have had to come into your practice, book an appointment just to give blood pressure readings. Now you can go online, submit them, and the practice can have a look at them. If they look like you might need a bit more of a review, then the practice can get you in. But for most times, they can just say, that looks fine, we'll wait until next time and get your readings next time. again, young professionals, I guess this is a obvious one as well, but for someone like myself working at home, now with my broken ankle, I am trying to avoid leaving the house where possible because it's more of an effort than I thought it would have been. But in this case, if I do feel unwell, I can go online. I could use the NHS app, or I could go to the website, submit an e-consult, and then I'd only have to come into the practice if the practice deemed it necessary. So it means that I'm sort of leaving it up to the person who's had that clinical training to make that decision. And then the final thing, just really key to point out, is that e-consult is not for everyone, and online consultations are not for everyone, and that is absolutely fine. And there's lots of different reasons why someone might not be able to go online. So that might be that they don't have internet, they might not have it available to them, and it might not be appropriate to them. We've put things in place so that practices can help more people go online, or they can receive everything as online. There are phone questions that they can use, or but we also say is do keep your phone lines open, because they do need to be open for other people. If you can open your walk-in, keep it open if that's appropriate for your practice, because there are always going to be people who can't use online. And what we have found, and we hadn't necessarily thought this was going to happen, but practices are now saying that in some areas where they've moved more people who can go online, it's actually saved the phone queues for people who can't go online. So it's kind of reduced that initial phone queue for some people. This isn't the same in every practice, but that is something that we have heard from particular practices. So I've put this up here. So this is just initial demographics and a bit of feedback, and I'll share this afterwards, but I thought it's just key to put in that patient demographic that people immediately assume it's only going to be that 20 to 29 age, or that sort of 16 to 29 age range. But it's not. It's quite spread across the whole of the demographic range. I mean, even in this one, we've got 1,272 people who are above the age of 90 who have used eConsult. And Dorset in particular has got a very high satisfaction rate as well with eConsult. So while it's not for everyone, and that's absolutely fine, this is a very good satisfaction rate. And there's a lot of people who are benefiting from using the platform. There's a few bits of patient feedback which I just pulled just before here, but there are lots of different benefits that some people see, and some of it is they just needed extra time. Some people, they didn't want to come into the practice because of something like COVID, so this has given them the opportunity to contact them without the need for that. Some people, for example, we do hear a lot of people with anxiety issues who don't like coming into a practice or leaving the house where they can. They've found it much easier to be able to go online because they're not having to speak to someone. They don't feel rushed in doing that. So now they can go online, submit it in their own time, and then get the information through to the practice. Obviously, there are different benefits for different people, but these were just a couple that I've just pulled out just now. Because of a question that came in as well, so someone asked, what are the benefits to practices? I know Mark and Nikki might be able to share a few more specific ones for the Dorset area, but these were just some other ones that I did just highlight very quickly just before coming on this call as well. So these are comments that we've had from practices, and as you can see, there are lots of different reasons why they've benefited. But one GP we had in South London had estimated that he'd saved over £40,000 a year for his practice. And this was just through better resource management, because he was now able to make sure that GPs only saw the GP needs, and the administrative staff were able to look after the other ones. So he actually found he was getting more admin requests than he thought. So he was able to hire another receptionist as opposed to another GP, which, as you can imagine, a GP is a more costly thing to a practice than an admin staff. The other ones are, for example, you get more information through an e-consult. So when you actually come to the face-to-face and telephone consultations, you've already got a lot of that information. So you can actually get straight to looking after the patient as opposed to asking extra questions. And then other ones that we had, so a practice in Devon, I know when COVID started, so they had actually been using eConsult for quite a while before. They actually said that because of eConsult, they were able to manage the demand much better, because all of a sudden there were far more people wanting to ask questions about different things. So getting a lot more people coming through. If you want any more extra information on any of these, I'm more than happy to share, but I do want to just make sure there's enough time for questions at the end. So I'll just skip through this. So I've put this up here, and I know some people probably used it, but there are a couple of things which have been built into eConsult more recently, which potentially you might have missed. So there was a clinical review template, so questionnaires that I mentioned before. So these are from helping patients with long-term conditions, and these are we're increasing these all the time. So I think there's something like 12 at the moment, but considering 6 months ago, I think there was one. We are increasing these all the time, and there's a lot more planned. So we do realize that not every long-term condition's on there at the moment, but that's only because we had to start with some to start with. We've got photo uploads built in to clinically appropriate eConsult. So as I mentioned, something like a rash is a really key example here. So as if you're submitting an eConsult about a rash, being able to put a photograph of the type of rash it is can be a huge benefit to the GP practice. There's pediatric and administrative specific questionnaires as well. So pediatric is obvious, it's about child-related issues. Whereas administrative, that's things like sick notes, GP letters, questions about prescriptions. These are much shorter and miss out a lot of that clinical information because they are administrative based. So from a patient point of view, if you're thinking about the time saving, if you are just asking for a sick note extension, and this is kind of a regular thing you would do, you can go straight to the administrative section, submit that eConsult, and then it can go through, rather than you having to answer some clinical information. Or the other one is phone up the practice, wait in an hour-long queue just to ask for that sick note extension. eConsult is all available through the NHS app. So if you do use the NHS app and you consult with your GP, it actually uses the same questions that are built into eConsult, and it goes straight through in exactly the same way. And the final one is information prescriptions that are provided by HealthyNote and also now HCI. So these two companies which we've partnered with, and this, from the name anyway, is much more relevant to the GP practice, but from a patient point of view is hugely beneficial to the patients. So these companies put together very informative videos on lots of different healthcare issues. So for example, asthma. If the GP wanted to help a patient understand how to use their asthma inhaler, they can bring up a video of how to use an asthma inhaler, which is NHS approved, and send it through to the patient. Obviously, this does work for only patients who understand and want to use that kind of watching videos afterwards, but it can make the response from a GP hugely beneficial. Even if they've spoken to them on the phone, they can then follow up with this message, which includes all of this. So I know, for example, they put in a lot of information around the COVID vaccine recently. So there's some new videos there about how the vaccine works, how the kind of inoculation would work, etc. So the GP practice can save them a lot of time and then provide the patient with a lot more information. So the final thing which I just wanted to highlight here is over the last year, really, I have been putting together a lot of patient resources, information, and tools that are available for either patients to use, practices to use, patient groups such as HealthWatch have asked for these things. So these are resources to help educate more people how to use eConsult, whether that is with newsletter content, with videos, with PDFs, with webinars like these, content for social media. We've been putting these together based on what other patient groups have asked, and we're more than happy to help put more of these together. So one example was just before Christmas, a group said, what about an easy read guide for people with learning difficulties? We immediately after the call jumped on another call and started thinking about how we could put that together. So that's now being tested with another PPG group at the moment. And once that's there, we'll then add that to this list of resources. So anything that you think could be helpful to help educate more people, that would be great, because we can just put that together for you. But yeah, we realize that some practices are struggling with finding time to really help educate patients on everything. So that's where sort of either yourselves or we can help with this. So these are available via our patient website. So this is econsult /NHS-patients. This is a URL that I can share afterwards, but there's the GP finder there. So you can type in the name of your GP practice and it'll take you straight to where you can start an eConsult. There's a list of FAQs, there's how-to patient videos and guides. And now recently, last week, I added the downloadable resources for PPGs or patient groups to use, which is those information I just mentioned. And next is the patient Facebook community group. So this is really new. I haven't really shared this very much, but I'll share with everyone after this. So this is meant to be a patient forum or kind of like a community group where patients can share with each other things that they've found useful about eConsult, or share things which they know for example, their PPG group has shared a particular newsletter which helped educate that particular patient group on how to use it, or benefits that they've seen. So we want this to be patient run. eConsult will sit in the background and answer any feedback or questions, but essentially we want this to get to the stage where we'll find some key patients who want to run this and we'll make them the admins of this. And then finally, the last thing is our demo site. So this is available for anyone to use who wants to kind of find out a little bit more about Econsult and how it works, but without worrying about sending something to their GP practice by mistake, because obviously we don't want to be adding to practice work at the moment. So this site is available, and anything that is submitted on here doesn't go anywhere. So nothing is stored after this. It doesn't get sent to any GP practice. No one looks at anything. So don't share it with people with the intention of them using it like Econsult. But if you want to help show someone how to use Econsult for the first time, they can play around on this. They can upload photos and they won't go anywhere at all. So it's kind of there available as a tool for people to use. Also, as I mentioned, if there are any questions that people feel uncomfortable asking about or they think about in the middle of the night later, you can send them over to us. This is the email which I'll look at, but we can share our own emails afterwards as well. So yeah, please feel free to ask anything, give any criticism, give any feedback, because it's all useful for us in helping to improve the product. I don't know what is the best thing to do next, but I know there were a couple of questions that were sent through. I'm more than happy to go through maybe some of those first and then take any questions from the floor. Okay, so we had a couple of questions, and Mark, Nikki and Noon, please feel free to jump in if I miss anything off or if you've got some input to add on there. But so I know there were some questions, and these are reasonably similar, but what is the evidence that local Econsult is improving access for patients and giving better health outcomes for them locally? And what feedback do they have from practices and GPs to support the purported efficiency savings? So I tried to put, oh, sorry.
Do you want me to pick that one up, Jim?
Oh, did you miss that? Sorry.
I said, do you want me to pick that up?
Oh, yes. Yeah, go for it, Mark. Yeah, I know. I think you had written some stuff on that before.
Oh, brilliant. Yeah, I'm the transformation director for Econsult. My name is Mark Thomas. I've worked with lots of practices across Dorset, but for 18 years, I was a managing partner, practice manager in a practice in Torquay. Devon and Dorset CCGs are the highest users of the Econsult platform. And again, that dispels this, the silver surfers not using the internet and so on, because Devon and Dorset have a high elderly population. I had the highest elderly population in Devon, but high users of Econsult. And how it helps practices, we can actually become more efficient. We can treat more patients, because one of the things that's in short supply across the country is GPs. So actually a wider team in practice can help and support patients. You'll be seen by the right person at the right time, and your health can be managed, as Jim's identified, perhaps even remotely with a simple message. But the key message, if you need to be seen, you'll be seen. Now, we've got key practices in Dorset, Bridport. We've got obviously the Shaw Medical Group around Bournemouth that have the same difficulties with high deprivation, high elderly as we do in Devon. But relatively speaking, their patients are embracing this digital change. If I ask for a show of hands, how many of you have been to the bank in the last year? Now, a few hands, not many, because you've got a digital way of working. And certainly we're seeing that now in Dorset, one of the highest users. Patients have embraced that change, understand that GP practices are there to help them. But actually, you don't want to be in that queue of 40 odd people on a phone. My dad's 81, lives in Torbay, and he does an Econsult once a month because he does not want to be caller 42 in a queue for an hour on a Monday morning. He's seen the change, he gets what he wants, and he gets a response the same day. However, locally in Dorset, we've got lots of positive feedback. We're seeing those changes. People are embracing that new platform, but understanding sometimes that Econsult's not appropriate for them and they will need to ring the practice. The more people that do Econsult, the easier it is to get through to your practice, and you will notice that. We've got practices in high deprivation parts of certainly Devon, where their patients are finding a much better service. They're more efficient. GPs are a nicer place to actually be in for both staff and clinicians, and they're able to see their patients. I'm sure some of you have heard of CQC, the Care Quality Commission. Lots of practices have issues with patient access and have failed CQC because of that. Econsult has helped them come out of those special measures, delivering a better service, more efficient, with the same resource they had before, but able to treat up to 20 or 30% more patients. What we also know, and this is true in Dorset, 20% less people are attending A&E because of Econsult, not getting told no at the front door. There are no appointments, submitting an Econsult. A lot of people, even in Torbay, would go to A&E for their first line of primary care treatment for head lice. You know, that's £1 a bottle in Poundland. You do not need £100 worth of NHS treatment at the front door of A&E. And that's where Econsult works. It gets through to your practice. The practice will manage you the most appropriate way and can help you and your needs. And that's what we're seeing. And 40,000 people a month do an Econsult in Dorset.
Mark, I've just there's a couple more questions I think would be quite useful here. So I think Sue's asked a question which comes up time and time again as well. So as I mentioned before, patient safety is hugely key for us. Econsult was started by a group of NHS GP clinicians, and it's kind of there for a reason. What we do get is a bit of feedback from patients around meeting red flags. So they're either being told to phone their practice, or, for example, they're told to ring 999. The reason why that has happened is because as a patient, you've probably answered something which, from our perspective, has suggested which you might need more critical care. This is a warning screen, and patients can go back and change their answer, but we've let the patient know that from our perspective, something has suggested that they need more critical care than a GP practice can give. And the reason why is because with Econsults, a GP might not be able to look at that Econsult for the next sort of working day, which is how long they've got to respond back to a patient. The practice will try and look at everything within that time, but there are certain things which we think might actually need to be seen more quickly. However, having said that, we do know that, for example, our pain scoring system does need work, and this is something we're really improving at the moment. So we know that a score of 1 to 10 doesn't necessarily work across the board because pain's so subjective. So, for example, someone's 10 might be someone else's 1. And if you're giving a 10 score, because of the way that pain works, it suggests to us that more critical care is needed. What we're doing is we're going to replace that with something that we've already been using in A&E and we see works well. So rather than asking 1 to 10, it will be, how does that affect your pain on a day-to-day basis? So, for example, the lowest one will be, I can do everything day-to-day, but it is bothering me in the background. Whereas the highest level will be something like, it completely debilitating level of pain. I can't do anything without anyone supporting me do something. So that's how we'll be able to sort of see that much more accurate level. And sort of we've proven that works. So yeah, we do know at the moment that there are things which need to be improved on that. And the other thing which I think should cover a question that someone else had sent in before is that particularly for patients with long-term conditions who, for example, do have a certain medication and a certain type of pain in a certain area that might suggest to someone who hadn't been seen by a GP in a while that it is something more critical. But because it is part of your long-term condition, it's part of a multiple condition which you are managing, it means that actually don't need critical care, and you know that far better than we could ever know. And it's sort of a relationship you've built up with your GP. So we know that for some people, when they're submitting this, and it is about something that's been going on for a while, it isn't something super critical. So I think we're also doing work to look at how GPs can connect with patients who have got long-term or multiple conditions that need managing. That, for example, if you were a patient that had just sort of joined the practice and you submitted all of these issues, it would be more serious and you would need to see someone. But because you've been managing this for quite a while, you know it far better than anyone. So we're looking at ways that we can connect through with that at the moment. We know that it's not perfect at the moment, but that is something we're really working on because we know that it's frustrating from a patient point of view. And I'll just do one extra question here before I open up the floor again to more questions. But we do also get feedback that Econsult seems to ask the sort of questions that should be covered in your GP notes. Is there a way of bypassing this long route? So that is a great question. And again, something that we do hear time and time again. So what we've done is we've done a lot of work recently with the NHS app team and Nhs Login. So hopefully from now on, more and more people start using Nhs Login, NHS app. And the more we work with them, the more information it will pull directly from your NHS records through to the GP practice. So for example, it will have a lot of those questions which aren't related to this initial request because it's all there in the background. So it won't need to ask you those questions. And the other thing which I know some people find frustrating is being asked about the amount of alcohol they drink every single time they submit an Econsult, or they're smoking every single time they submit an Econsult. If you've submitted 2 in a week, your amount of alcohol you're drinking that week is probably not changed dramatically in that time. So we understand that that can be frustrating. And what we're doing is we'll probably make it so that, for example, it will be something like every eConsult you submit, if it's every 3 months, it will ask you that question so that the GP records can be kept up to date accurately. But if you're submitting one a week or something, it won't ask you those questions because they don't need updating, because it's already been asked recently. So there are a lot of things, and what I'd say is these questions are questions that we've heard from other patient groups in the past, and we're starting to do a lot of work on them, and hopefully a lot of these things should be live very shortly. Again, we've had to make sure that we focused on COVID to begin with, which is why a couple of these things did go down the priority list a tiny bit, but that's only because we've been looking to make the platform safe and usable for all practices across COVID. Now that that is sort of been in place for around a year, we are looking to help put all of these improvements in place. Mark or Nikki or Newman, just while I go back through my emails from Jim and to check any of the other questions that I might have missed, do you want to answer any of the other questions which have come through on the chat? Or Mark, I think you might be on mute.
There's a few questions, obviously, talking about the usage of the platform. And remember, as Jim said earlier on, it's not for everyone. We don't have every template for every condition, but there are more coming. But remember, for every patient that can do an eConsult, the more that can actually, it will free up the telephone lines for those who can't. And that's the benefit. Nationally, we know that there are some templates that if you put in your condition, you might be diverted to A&E and 111. We are going to reduce that. That's going to happen very soon. We are going to add new content as well, because again, we recognise we don't cover everything. And the world has changed. This time last year, there were very few practices doing the volumes of eConsults that are today. But with total triage, that's everybody using the telephone or eConsult, we know the world's changed, and that's COVID driven. So we have to change the platform to do that. And we're seeing that. So nationally, 6% get diverted. That's still too many, as Jim's identified. We're changing the platform to do that. Lots of new content coming. I know last year the big push was for HRT, menopausal templates, pregnancy. They're now live, but we have got more content due this year, which will help patients. Remember, it's one condition per template. If you use the general advice, you'll be able to put more information. But the templates are there to help you, to lead you through your condition. And that's why last month we had 1 million eConsults submitted by patients, and that's across the UK. And so Dorset is one of the highest CCE areas for submission.
I just saw, sorry, this came through as a question around being able to send messages directly to your GP practice, and especially to people who aren't necessarily GPs, so for example, physios. This in particular is something that we are working on and should be live quite soon. So creating a two-way messaging system that GPs can sort of initiate, or GP practices can initiate, to help speak to patients sort of more freely. The reason why we don't have just an initial message box for a patient to just submit something through to a GP practice is for a few reasons. And one of them is because some patients will just start abusing the system. If there's, for example, just an email box where a patient can submit a message, even if they were told it was just for a administrative purpose or just to ask questions or give feedback to the practice, you will still get patients coming through and saying, my head hurts and I've had this pain for a certain number of days. Unfortunately, that is always going to happen. So we do need to put the safety sort of features in place, because, for example, if that went through to a GP practice and it sat in a feedback inbox and no one looked at it, there could be some sort of serious implications because of that. So having those patient safety measures in place is really important to make sure that kind of the safety of everyone is kept up. However, having said that, we are looking at ways of the GP practice could initiate that first sort of contact with the patient and then get information back from them. So if it is something like a physio, the physio could make that initial contact with the patient. They could ask them questions about how their sort of physiotherapy is going, or how the kind of the pain's going, if it's recovery from a certain injury, and then get a message straight back. So it would bypass that eConsult process of having to fill in information about a new request. So it would be something that they could make sure that it's sort of ongoing there. So hopefully that answers that question.
Yeah, and just again to remind you that the eConsult platform was just not about submitting to the GP practice. The way that we designed the platform, there are lots of self-care information, pharmacy information, and local services. So actually not everybody submits an eConsult when arriving on the platform. They want to know more information about their condition. And we kind of, we know that from volume in terms of the number of patients that just use the self-care information, but it's genuine, proper NHS information, not Dr. Google, so they can read that. And as Jim's identified, practice now can share information back to the patient about their condition with a leaflet, obviously an online version, a video down to the exact inhaler a patient uses, and that's all being able to watch by a patient in their own time, whenever they want to. So again, it's not just about accessing the surgery, there's lots more information than that and using the full platform.
Because there's sort of 15 minutes left, I thought it'd be really useful now to hear anyone in particular, if they want to share any particular feedback about Econsult, anything that they've sort of heard, any criticisms of the platform, because as we kind of mentioned, it's much easier to improve from a criticism than it is to improve from anything that's just solely positive. So if anyone does have anything in particular they'd like to share or any additional questions, please feel free to ask, because we've got the team on here and then we can also share it with anyone else. I immediately see 2 hands come up. I don't know who's first, so I'm just going to go on who's in the top of my screen, which is Sue Smith.
Yes, thank you. I've used Econsult a couple of times. My question would be, and I think probably the first time you use it, you don't know what you're doing, and the next time you use it, you know your way round. But I actually had to tweak mine because it said ring 111. Yes. I knew I didn't need to ring 111. I just wondered what conversations you're having with 111, and are you using the same sort of protocols, and has the uptake from has it been greater uptake with 111 because of Econsult?
So I don't know if Mark might be able to add anything extra to this, but yes, we do speak with 111, and I know that there's been conversations in the past about sharing kind of the questions and sort of the algorithms that we use between them. Obviously, phoning up 111 involves phoning, and an Econsult goes directly through to the practice. So there are some sort of key differences between it. I actually don't know off the top of my head whether NHS 111 have seen increase because of Econsult. I'm sure that's quite difficult to judge currently because of coronavirus. It's been hard. I know Mark mentioned about A&E attendances earlier, but that was pre-COVID. It's really hard for us to sort of see which one's related to COVID, which one's related to Econsult at the moment. But what we can do is, I know that we're in touch with the 111 team, and we can speak to them about that. In terms of algorithms and questions and things, I guess at the very sort of basic level of looking at it, they probably do use fairly similar things. And we have worked with the team to help sort of write some of their content, and we've sort of shared content between them. All of our questions and algorithms are built by NHS clinicians. So we have a team of something like 26 who write the content, who are from a huge variety of backgrounds. So from surgeons to pediatric nurses to GPs. And all of the questions are reviewed. I think, to be very truthful, we're probably guilty of making them a little bit too risk averse to begin with. And I think that's exactly what you've found in that. We're kind of now at the stage where we can start refining the questions, make them better, make that risk level much better. Because from our point of view, it's much better to go in being risk averse than to make them sort of completely free access and for something dangerous to happen. So we're now at the stage where we're really starting to spend a lot of our time making those questions better and collecting feedback exactly like yourselves. So we get quite a lot of feedback via Facebook, etc., of saying, I submitted this and I was told to phone 999, but the reason why I don't think that was appropriate for me is because of this. And that means we can then go back into the questions and change it. Mark, I don't know whether it might be better that, because I had just 2 extra hands up here, that I might answer these 2 questions first, and then we can provide any extra information afterwards. So Sue, I can make sure the team speak to 111 and get a bit more of that information for you.
Thank you.
Ian, I think you are next on my screen anyway.
Jim, thanks for the presentation you gave, and I think it's helpful. My point is more the confusion that is made by multiple systems. Yes. You're obviously doing Econsult because the other systems which have been put in over the last 20 years are not doing a good enough job. And it really does worry me that a consumer like me who does manage his own conditions, I would be immodest and say pretty well, still have the problem of knowing who you should be contacting, and something as simple as booking a blood test, which I knew I needed at a particular time. You go onto Econsult and think, why can't I do this? Eventually ring up the GP's practice and they say, oh no, we haven't done that for the phlebotomist yet, you know. So it's one of these difficulties. It's not your fault, I'm sure, because I'm sure things are in there, but it's very important that we know who we're talking to, whether we're talking directly to them or not. And the other thing, if I may, which is my written question that I put in, was about the access that people have to your medical records, because I had a situation where I came out of one hospital and the next hospital couldn't get at my medical records, even though it's a day in between. Thank you.
So two really good points there. One of them I probably can't answer as well because unfortunately it is a slight issue with the NHS in general, but the first point you had there around the multiple different apps, and I think that was really highlighted by that image I showed you earlier of all these different things that practice has. What I kind of would recommend on that, if you are worried about using that, is use something like the NHS app. We're built within the NHS app and we're the first online consultation provider to be built into it because we do have that sort of tried and tested history, and because our clinical questions are kind of at the level they are, and because we've worked with the NHS app team on that. Other providers are also starting to be built in there now, but from a patient point of view, it's the one place you can go to and access all of that content. For you, it won't feel like you've left the NHS app because everyone's integrated within it. So if you're on the NHS app and you want to submit something to your GP practice, you are actually being asked the same questions which are built in with Econsult, but it's being put through the NHS app. So you can trust it there because it's directly through the NHS app. There will be particular things which you might want to continue using in your practice, and that's absolutely fine. But I think it has got to the stage where there's quite a lot of different things available for patients, and it is really confusing. I know I find it confusing in my own practice. So for myself, it's the NHS app, and I'm kind of using that as my route into those other apps that are there. The other point around accessing patient records is something that I probably can't answer because it's sort of far above my pay level and also in a different company from me. But there is an issue that we know, and I'm sure other people in the NHS can agree with this, that between clinical systems and between hospitals and each other and between GP practice and each other, there is an issue with them talking to each other. And this is kind of a legacy thing from GPs, for example, starting off as franchises and then sort of being able to move patients between them quickly. And also because only recently they've gone into more digital records. So that's a legacy issue, and we know it's incredibly frustrating. And that's kind of, I guess, one of the more end goals for Econsult is to help join all these different dots together to make it easier from the patient point of view, so that if you did go to one hospital for A&E, but actually another hospital's closer for physiotherapy, which is the case with me, the records are very quickly and easily moved between each other so that information is passed. But yeah, I'm afraid I probably don't have the best answer for that. I can just share your frustration there.
Thank you very much.
There's one last hand up. So Andrea, I'll just make that available for you, and then if there's anything else at the end.
Thank you. Yeah, I used it only the other day for my dad. He's 90 and wanted to tell me about his issue. So I used the Econsult because it gave us the time he needed for me to type it in using his words. The only issues we had was, as mentioned by Sue, there was some tweaking because the pain score, I had to reduce it slightly because we didn't need any urgent care. And the other one was medication. So I just simply wrote, please see prescription.
Yep.
I think it was really useful for Dad because it gave him the time he needed to tell me about what he wanted. And also the following day, the GP rang him and resolved the issue. So I think with a few tweaks, yeah, it will, because when I did try and ring the surgery, as you said, there was a long queue, and my dad doesn't respond well to press 1 for this and 2 for that, where he had none of that on the Econsult. And he checked it all, and then he submitted it. So yeah, he will get the swing of it, even if he's 90, because he's perfectly okay. He just wants that time to think about what he wants to say. So I would say when it's the right thing to use, it's a very, very good tool to have in addition to everything else that we all need.
Yeah, thanks for that. And yeah, I think just that, as other people have mentioned, the pain score is something that's like of a really key priority for us, because we do know that it can lead to this frustration, especially for people who are using it the very first time. That can be huge, because the whole point of trying something new is you try it for the first time, and if it's good, then you'll probably continue using it. If it's not, then you'll probably not use it for another while until someone else recommends it to you again. So we do realise that is something that needs to be improved. Mark, I was not sure whether you had one final point.
Yeah, I was going to say thank you, Andrew, for that feedback. I think that's a critical point. We know there's some things that we need to change, but we also know that a patient might submit at 3 o'clock in the morning when the practice isn't there. So that's why we have to have the safety features. I think it's great that you and your dad submit an e-consult. That's what my dad does. He gets the benefit. He gets a response the next day, and he doesn't have to join that queue or get out of bed at 7:50 in the morning to sit on the phone queue for an hour just to get through. But what we do know is that patients that do use the e-consult, they find it quite therapeutic. They can put in their own words. They can express how they're feeling. That's live history that the GP gets to look at in practice. That's the reason for e-consult.
Sorry, I've actually just seen there are 2 more hands. Sorry, I completely missed those. Rosemary and Phil, I believe. Rosemary, I think you might have had your hand up first.
Thank you. Yes, I have used eConsult a few times. The last time was this morning, and I found it a completely different experience from what I've experienced perhaps a few months ago, where I had a long process of registering and needing to take pictures of my passport or my driving license before I could gain access. The driving license is missing. The passport has a blurred picture of my face. And so I ended up not being able to use eConsult over issues that I've been trying to get hold of the practice for the last 2 weeks. So I feel it's been made incredibly complicated where it wasn't that complicated a few months ago. Am I right that you've changed all these things?
Yeah, so that's a really good point. So what that is actually is when we integrated with the NHS app team in the NHS Login, that's sort of been built in. So the NHS Login is now available for patients to use within that, which is actually what you've been asked for information on. So the NHS Login has benefits to it. So it will, for example, if you sign up to use the NHS Login, which is why I was asking for your passport details, it will mean that your demographic details, so your name, date of birth, postcode, etc., will automatically always be filled in. However, what I found is some people, and because that's one of the issues which we're fixing at the moment, is that patients are being asked for that during the e-consult, and it can take up to 24 hours to get a response back from the NHS Login team. We didn't realise it was going to take so long to get that validation, so which is why it was built in as an automatic thing. What's going to be the case now is it will say, do you have NHS Login? If not, continue with eConsult. And then at the end of the eConsult, it will say, do you want to sign up to NHS Login, so that next time you won't have that kind of slow process. And it's kind of there as a choice for patients. You don't have to sign up to NHS Login to use it. I believe, and this is kind of our issue with some of our design, which we are changing, is underneath where it said sign in or something, it would have said sign in as guest. And that would have meant that you wouldn't have been asked about your passport and anything else. So yeah, that's something that we're working on and should be fixed actually very soon, but it will be changed so that if you want to sign up to NHS Login, you're asked at the end as opposed to the start going forward.
Thank you.
Phil, I think there's one more hand up. I realise we're towards the top. Sarah, I had also seen your comment as well. So what I can do is after this call, if I can either spend a couple more minutes at the end of this call if that wants, and I can go through the demo site very quickly to show people how to use it if they haven't used it before. Otherwise, we've got some online videos and things which do go from sort of start to finish of using an eConsult for people who might not have sort of used it before. Because I realise I wanted to make a balance between people who wanted to give feedback on previous versus people who might not have used it before. So Sarah, if that's of interest, I can make that available for you afterwards. But Phil, I realised your hand was up and I know you've been waiting for a while. Phil, I think you might be on mute as well, sorry.
Hello, can you hear me?
Yes.
Yes. My question is quite simple. At a recent PPG meeting, the doctors and practice manager were there, singing the praises of Econsult, and having listened this afternoon, I can understand why. But my question to them was, have you tried using Econsult yourself to see what hoops we have to jump through? And the answer was, oh no. So the point is, are these presentations being given to GPs, etc., or are they encouraged to go through the system? That's the question. It's quite simple.
Phil, I would love you to be on some of our calls with GP practices. Mark and Nikki and Newman, that's kind of what a lot of their day-to-day job is at the moment, is giving presentations more aimed at practices. And yet, as part of our training, we do recommend that every single member of a GP practice does complete an Econsult as a tester before we go live with it. We are unfortunately unable to police that, but we do recommend that they do that, because as you can imagine from anyone who's ever worked in retail before, trying to sell something which you don't know what it is and have never used before is next to impossible. So for a patient asking what is Econsult to their GP practice, if they've not used it before, they might understand the benefits at the end of it, but they might not have used it. So this is something we highly recommend to all GP practices. And we are doing a big push at the moment to kind of get people to re-go through the training so they do understand the kind of things that are being asked in an Econsult. Because some people, it is very different from just booking an appointment. There is a big difference between submitting an Econsult and going on and saying, I want an appointment next week. So yeah, it is something that we are trying to improve a lot. And I know Mark and Nikki and Newman are kind of doing a lot more of this, but we're trying to help educate both sides of the equation at the same time. So that's why I kind of wanted to make this available, but I want to reassure you, we are doing exactly the same thing with practices as well.
Thank you.
Jim and Gil, I know that we are at the top of the hour here, so is whether either I can stay on and give a bit quick demonstration at the end, otherwise I'm more than happy to sort of share some content and videos with people afterwards.
Thanks very much, Jim. I know that my colleague Jim Gammons has got to leave shortly for another meeting. So if you've got the time, Jim Roberts, that is, and people would like to see some more content and some more demonstrations, please do stay on the call as long as you've got the time.
Sure. Yeah, I'm more than happy to stay on for sort of 15-20 minutes to show that.
Thank you. And just to let everyone know, I am going to save the chat as well, so that as well as we've recorded the meeting, but we're going to save the chat so we've got everyone's feedback as well. So don't think that won't be captured.
Okay, what I'll do, I'll try and make this quick because I will have to leave in 20 minutes, but I can show everyone quite quickly. And again, we've got this in video form as well. So what I will do is I'll share this. So Econsult is available for people to use from their phone, computer, tablet, so anything that is online. And what you'll do normally, so I've just brought this up because this is a practice in Dorset. So this is Bridport Medical Centre. And what you do is you go to your GP practice website or the NHS app. I'll just do the GP practice website for now, as opposed to the app. But you'll go to your practice website and look for the Econsult banner. So here they've got what is Econsult, which takes you to an information page on it. But they've also got consult your doctors online, and they've also got click Econsult to start here. On other practices, it looks different than that. It will be a big banner that pops up in the middle. So I'll just bring up this one. So this is actually a practice in Devon, but it was just a practice I was speaking to earlier. So it's sort of just on my mind. But you just sort of type in your practice name, go to, I've gone to different part of their website. You'll go to their practice website and a banner like this will pop up. So it will look slightly different for different practices, but for most practices, it will come with a banner like this. So usually look for a banner like this, and then you can start an Econsult. So once you've clicked on the banner, it will take you to a page that looks like this. So this is kind of the main home screen of using an Econsult. So what I'll do is I'll just close these so I don't accidentally send an Econsult to that practice. This is the demo site, which I mentioned earlier, and this is kind of available for people to use. Usually outside of COVID times, this yellow box wouldn't be here, but this is kind of up-to-date information box. So I think there's information that's just been put in there about the vaccine to make sure that you're not just asking your GP practice about the vaccine all the time, and letting you know that Econsult is there for making sort of requests about symptoms, conditions, etc. So what you do when you come to this page is either select I want help for my condition, I want general advice, I want administrative help, or I want help for my child. If you have a banner like this one on your practice, these buttons are kind of already there straight away. But for practices that don't, you'll come to a practice like this. It doesn't make any difference which one it has, they're both the same. So I want help for my condition. This is for quite specific things. So for example, back pain, coughs, mental health concerns, etc. I want general advice is for more general things. So for example, if you've just got tiredness or weakness of the body. So it's not specific about a specific area, but it's kind of much more general health concern that you kind of want to go down. The real difference between these is that I want help for my condition will take you to this list of conditions, and these are the most commonly requested things at GP practice. By clicking on one of these, it's instantly taken you to kind of a much more targeted set of questions. So for example, I want help for ankle pain. It already knows it's about your ankle, so it won't ask you questions about your head, for example. Whereas if you were to go down, I want general advice, it will start asking you, it starts from sort of zero knowledge, if you can see what I mean, rather than starting from ankle pain knowledge. So it will ask you a lot more questions because it has to help work out which kind of area it's looking at. So I would always recommend that you start with I want help for my condition, have a look through these. There's also an A to Z here, there's a search bar, and there's a body map as well, so you could click on the part of the body that it's related to. So that's kind of where I would start. If you really can't find anything that sounds like it's related to what you're looking for, then you'd go down the I want general advice. If you've got more of an administrative request, so for example, something like a sick note, a GP letter, a question about test results, etc., you click on I want administrative help. And every time you click on any of those boxes at the top, it will take you to this page. So this is just letting you know that this is the demo site, so nothing's going to be submitted. But it comes up, first of all, with a warning screen, just to make sure that it's nothing to do with asking a question about the COVID vaccine, and that you've rested the privacy policy, which is available here. So it's just letting you know they're going to ask you a couple of questions about your request. So then it will take you to the next couple of questions. And these initial questions are quite similar based on whether it's clinical or administrative, but I'll just show you the administrative one for the moment, just because it's a little bit quicker. So you say, I want help for myself, for example. And then here, this is a form that's just telling you again that this is for administrative issues rather than clinical. And the clinical one kind of has almost the reverse of this. And the clinical one will also ask you at this stage, can we make sure you're not suffering from some things that sound like a stroke or a heart attack? I know for most people that sounds very obvious, but there are people who make requests to their GP practice having a heart attack and knowing that they're having something similar to a heart attack. So it's just making sure that we're making sure that the right people go to the right place. So this is just saying, confirming that you're not using it for medical issues. This will obviously be different when you're going to your own practice. This is just the address we use for the demo practice. So you just say yes, and then this is your sex. So I just want to highlight here that this is your birth sex as opposed to your gender. And the only reason why we're asking this is because certain conditions can be different based on your birth sex as opposed to your gender, which you now identify with. So we do know that some people have questioned this in the past, but this is for medical reasons, which is why we're asking your birth sex here. And again, this will be your date of birth. Rosemary, the thing which you mentioned earlier about the asking for your passport details and things like that. So if you were using Nhs Login as opposed to, so if you'd signed up for Nhs Login, all of this information would already be inputted. But for us, we didn't want to have a password at the start because for the very reason that I brought up my colleague, that if you lose your password, it can be quite hard to get it back, especially when you do just want to make sure that you're submitting a request to your GP practice. So that'll go through. So here, this is where, for example, it's asking you about your administrative issue. So recent test results, sick notes, GP letters. So you just basically go through and you'd select the right option for you. And you'll go through and there'll be a mix. So this one, for example, is a free text box here. And then this one is what I was saying before, is like the structured questions. So some of them are yes, no, some of them are free text, and it will go through. And then So these are questions as well, which, as I mentioned with the NHS login, will start to remove out. So these are asking about alcohol units, which is so that your GP can keep their records up to date. So, and again, these questions are similar as well. At the end, it will ask you for your name and your postcode or address. And again, that's what would be filled in by the NHS login information. And then a contact phone number. So that's useful because while you might have a contact phone number on your GP record, you can let them know the number that you want to be contacted back on. So for example, we know there have been issues where if you're living in a multi-person house and the contact number that's down on there is the home phone number, but you'd rather that any person in the house picked up the phone, you wanted to go straight to your mobile, you could put your mobile in there so that it kind of makes it that they'd respond back to your mobile as opposed to the home phone. And again, your email address. At the end, you can ask for a copy of your answers to be sent back to you so that you know everything that you've submitted. So for example, when you go to your GP, you've got everything that you've submitted, because it might be actually they phone you back in a day, or it might be that they say, let's come in for an appointment in the following week, and you need a bit of a reminder on that. And again, there's also a survey, and this is just asked at the end. Both of these you don't have to tick. They're kind of, it's completely free choice for you here. The survey will be sent to you around a week later and just ask you about your experience. But essentially what you'll do is you'll just click next step and it submits your request. This is sent straight to the GP practice. We don't collect anything patient identifiable at all. That goes straight to your GP practice. Anything we collect is solely to just improve the algorithms on there. So we don't know anything about the patients who have submitted anything. That goes immediately through to the practice. But it will just let you know what happens next. So your practice is going to respond before 6:30 p.m. on Tuesdays. That's tomorrow. So it's letting you know it's one working day. They might actually, some practices have changed this. So it will say they're going to get back to you within the next 2 hours. Based on how your practice has decided to set up Econsult, that will be different. And it will also let you know what happens if you don't get a response. So that's kind of administrative. That I want help for my condition or I want help for my child. They go down very similar things, but these are much more clinical focused. And when you go on to a condition, you're asked if I want to help myself. So this will give you NHS trusted self-help information. So this is information put together by the NHS. So for example, one that's very key to use here is hay fever. So quite a lot of people can actually look after hay fever themselves, only in quite extreme situations when you probably need to see a GP in person. But there's a lot of information that you can get from the NHS of how to help care for hay fever from home. And this button up here can help direct you through there. Again, I want pharmacy advice will give you kind of over-the-counter treatments. However, if you do think that you want to let your GP practice know about something, you just say, I want treatment and advice from my GP. And this will take you through, as you can see, it looks very similar to the administrative one. And it will take you through and begin to ask you clinical questions about this. This is that warning screen that I mentioned you. So signs of a heart attack, signs of stroke. And you just mentioned you're not, haven't got any issues like that. And then again, it also asks about COVID to make sure that anyone with COVID is actually being directed to a more appropriate care. Because at the moment, GPs are trying to avoid getting COVID patients into their practice. And yeah, as I mentioned, these do just follow fairly similar, but they'll ask questions specifically about that clinical issue. So again, there's things that are free text boxes, and then things which are multiple choice. So it just goes through that. If you're doing it on your phone, it works in exactly the same way. It's just obviously formatted differently. The NHS app will, if you're using the NHS app, it will start the questions from here. So the NHS app, and it will look like this page, for example. If you are looking to submit a photograph, when you're going through, it will come up with a page and it says, do you want to submit a photograph? You don't need to at all. But if you're using a computer, it will bring up the files that are on your computer. If you're using your phone or an iPad, it will say, do you want to take a photo or do you want to choose one from your gallery? So you can decide which one's best. And then you can put an explanation of what the photo is showing and then send it through to your practice. So there are different ways to use it. The other thing which I can just highlight, so if you do have more long-term conditions and you want to sort of use Econsult to help manage them with your practice, they should send you the Econsult when they need a review, but this is where you can find them. So need to complete a review, and that's down here. This will take you to the review. So these are the long-term conditions which we currently offer support with, but these are improving and getting longer all the time. So things like blood pressure review, which will ask you for your blood pressure readings, because a lot of people can now take blood pressure readings from home, or for example at Boots quite often have blood pressure readings. So it means that you can save going into the practice or save having to book a face-to-face appointment just to do that. And it can be really useful for people who are managing that long-term condition to just submit their readings on that. The other one, for example, which we know is used a lot, is contraceptive pill review. So this again is asking your blood pressure, for example, and it can just be that you just need it to be kind of extended for the following year, but you do need to give those readings first. But this can be a huge saving for GP practices and patients. So this is where you'd start it. And again, these follow fairly similar things to the other ones that I just showed. The final one, just to highlight here, because it can be in a confusing place, is if you have, and I know obviously this isn't relevant right now, but hopefully we will be able to travel sometime soon. If you do need to ask your GP practice about travel advice, so for example, if you need vaccinations to go to a certain country, you can also do that via Econsult. So within conditions at the bottom is travel, and you can ask travel advice. And you can list the name of countries that you're planning on going, when you're going, and the GP can compare that with your current records and say, actually, no, your vaccinations are all up to date, or yes, you do need one vaccination, we'll get that booked in for you. So that can be another thing. Obviously, that's not used currently very much because people are not allowed to travel, but once it's back, this is kind of there for people to use. So hopefully that's a quite quick overview. Again, this demo site is available for anyone to use, so anything that you send on here doesn't go anywhere. But if you do want to play around with uploading a photo or something similar to that, or testing it out with a relative that you know might not have used this, feel free. I'll share the presentation with everyone after the call, and it's got a link to this in there as well. So hopefully that was useful.
Thanks very much indeed, Jim, and all the team as well.
Sorry, I'll just highlight, because I've just seen Dave's comment on there. So yeah, this is something that I think we're looking to change on there. But the reason why I just wanted to highlight is because I know that we've had feedback in the past that why don't we include things like trans on there, which is just because from a clinical point of view, your sex is different from your gender, and we're just trying to highlight that. But yeah, I think we are changing that to birth sex as opposed to just having the word sex or gender. So yeah, thanks for highlighting that out.
So I'll just unmute myself again, sorry. Thank you so much, everybody, for your time. All the PPG members and everybody else that's taken the time to come in today. As I said, I've saved the chat so that we can feedback anything that we haven't managed to discuss today. And yeah, thank you again. I think it's been quite enlightening in some areas. I appreciate that not everybody's question will have been answered. But Jim, did you say that you were going to give some more email addresses so that people can, they can also feedback to us as well, of course?
Yeah, absolutely. So when I share the presentation around, there's an email at the end, so please feel free to submit any question that you might have, any bits of feedback, criticism, feedback from anyone else, and either we'll try and answer it between us in this team that joined today, or we'll share it. So if it's a clinical one, for example, we can send it to the clinical team. Just to make sure that it gets to the right person.
Excellent, thank you so much. Okay, well, we will leave it there and let you all get about the rest of your day, and we'll be in touch soon. Thank you very much indeed, everybody.
Thank you, everyone, for joining us on. Thanks.
Bye-bye.